Hello, this is Dr. Lee, a introductory YouTube video about the right Epley maneuver. And by looking in the skull with the right BPV that's been diagnosed by me would be a stone crystals in this particular area, and we'll be moving it from this direction all the way to that direction. And that's going to be done by first diagnosing it over here, 45-degree angle like this, and then it will be 190 or even more like that. So literally you're taking the crystals, bend it around the loop, and it gets stuck. It's hard to see, but in that little ampulla right there. And then when it gets stuck for about a minute or two, then you stand up, and then it gets stuck right in that letter V, and that would be the crus where the ampulla comes in. So that's the whole idea of why we're doing it this way. All right, very good. So having said that, first my assistant will have the patient now start the Epley.
Okay, so this is your starting position. You're sitting up here. If your right side is affected, you're going to go ahead and lay down, and then turn your head to the right for 60 seconds. And then you're just going to stay here for 60 seconds.
So in that time period, his eyes will be twitching, and basically what's happening here is very small model, but the crystal is in the way back, and it's migrating like this towards the back like that. Okay, very good. And his head is a little extended, and that's usually the angle you're going to be at. And you can definitely do this at home. It's minimum 1 minute. You can do more, 2 or 3 minutes, and that's acceptable. Definitely not less than 1 minute. That's the key here. You notice there's a pillow under his shoulder, and his neck is a little bit extended, and that's what we'd like you to do.
Okay, and now that 60 seconds have passed, I'm going to turn his head 45 degrees onto the opposite side, and we're also going to stay there for 60 seconds.
So in this scenario, what happens at the crystal, I don't know if you can see it or not, if you were to go like this, by turning his head, literally, that crystal at the bottom of the U has now made it out to about like half level right here. So you're going to be like this, and it's almost like horizontal level, right about that area. Okay. And this is actually from a real human skull, and you're going to be like this, and pretty soon. So we're moving it from the bottom, slowly up, and we're about here like this. Again, same thing. This is not to say that all the crystals occur on the same side. Most of you will be doing this at home after we teach you how to do this a couple of times. And this is mainly for people that needs to continue the therapy at home. If this comes ever again, let's say a couple months down the road, it's not to guarantee the same side. And so you don't want to be doing the wrong side, a misdiagnosis. And we will make the diagnosis for you initially, and then tell you which side you need to be doing it on.
Alright, 60 seconds have passed. Now I'm going to have him turn his head and body all the way to the side, 195 degrees.
So in this scenario, what happened here is that letter U right here, that crystal is literally dropping upside down. So it's like this. You can see it over at that level. So it's sitting right at the point where they kind of meet together, crus, and that's where the stones are sitting. And that's where slowly they will migrate into that little V area where they come together, and they're called the ampulla. When they go into that ampulla, they get stuck. They don't come out. And so we like the patient to be in this position for also about 1 minute.
Okay, and that was our minute. So now I'm going to go ahead and have the patient give me a hug. Just going to lift him up.
Up, just like that.
And
it looks just like this, and now basically that guy just slammed into that letter V right over there. Very good. And then you stay like that. Now move your head a little bit, shake a little bit, and most of the time you'll be seeing some improvement right away after this maneuver. Okay, very good. So that ends the discussion for the right-sided BPV.
and what the reasoning behind it is all about. And you want to be doing this pretty much daily in the morning. And then, of course, you don't want to be lying on your right side when you sleep at night, okay? And that's the key here. All right. Have a great day. Very good.